Welcome back guys. After discussing about the secondary messengers, now let's see the hypothalamic hormones and the anterior pituitary hormones. Now look in this diagram, let's consider this area is the hypothalamus. Okay, so hypothalamus is considered as the master regulator of the entire endocrine system in the body. Okay, so it's the highest most control for the endocrine activity in the body is the hypothalamus. Now see the hypothalamus with the help of this pituitary stalk, okay, with the help of a pituitary stalk, it is connected to which gland? A pituitary gland. So in the pituitary gland there are mainly two lobes, anterior pituitary and posterior pituitary. Anterior pituitary is also called as the adenohypophysis guys, and posterior pituitary is also called as a neurohypophysis. What is the difference between anterior and posterior pituitary? See, anterior pituitary actually it is developed from a structure, okay, it's developed from a structure called as a Rathke's pouch, okay, from the palate, okay. So there is an invagination called as a Rathke's pouch, and this Rathke's pouch which is going to go from the mouth towards the brain. So it's the Rathke's pouch, okay, it will come in your embryology in anatomy. It is a Rathke's pouch which is going to form our anterior pituitary. So anterior pituitary is not a direct extension of the nervous system. Anterior pituitary, it is coming from a structure called as a Rathke's pouch. But what about the posterior pituitary? See, posterior is also called as a neuro, indicating it is directly neuronal in origin. It is developed from the nervous system. It's an extension of the nervous system. So origin wise they are different. Next, see, sometimes what happens is some remnant cells of the Rathke's pouch, the remnant cells, the leftover cells of the Rathke's pouch, in some people they forms a tumor. So the remnants of the Rathke's pouch in certain individuals they will form tumor, and that tumor is called as what? Craniopharyngioma. So craniopharyngiomas, they are the tumors arising from what? They are the tumors arising from the Rathke's pouch. Okay. Next, what else is different between the anterior and posterior pituitary? It's a connection. Okay, it's a communication. How they are doing with the hypothalamus. See, here is the hypothalamus. Now, the hypothalamus is connected with the anterior pituitary with the help of a blood vessel. Okay, there is a blood vessel which is communicating between the anterior pituitary and hypothalamus. So, what is the name of this blood vessel called as? So, these blood vessels are called as a hypothalamo, hypophyseal. Hypothalamo means hypothalamus. Hypophysis means anterior pituitary. So, this is called as a hypothalamo, hypophyseal portal system. So, hypothalamo, hypophyseal blood vessels you can say. So, they are communicating, they are connecting the hypothalamus with the anterior pituitary. Whatever the hormones that are coming are getting produced in the hypothalamus, they can be directly coming to the anterior pituitary with the help of the hypothalamo, hypophyseal portal blood vessels. But the hypothalamus, it is connected with the posterior pituitary with the help of neurons. So, you can see here is the cell body of the neurons. So, from the neurons, the axons are connecting. The axons are coming into the posterior pituitary. So, now what is this connection called as? A bunch of axons are coming down. So, these axons, they are called as a hypothalamo, means from the hypothalamus. Hypothalamo, hypophyseal tracts. Tracts means what? The tract means nothing but a bunch of neurons, a group of axons is called as a tracts. So, communication is different. Okay, the connections are different. So, here it's a blood vessel. Here it's a blood vessel. Here it's a axons. Here it's a directly neurons are connected. Okay. Now, having said that, now let's see what are the different hormones that are coming from the hypothalamus. Okay, now look at the hypothalamus guys. See, in hypothalamus, there are different nucleus present. Here I am showing you different colored nucleus like red color, violet color, blue color, green color, orange color. Okay, these are the different colored nucleus. How many nucleus I am showing you? 5 different colored nucleus I am showing you. Now, first of all, what are these nucleus, sir? Nucleus ka meaning, the exact meaning of the word nucleus is a group of neuronal cell bodies. So, these are nothing but the neuronal cell bodies. They are nothing but the neurons. Okay. Now, what they are doing? See, the first nucleus I am talking about, which is called as the arcuate nucleus. The name of this first nucleus, the red color nucleus, is called as what? It's a arcuate nucleus. Now, what this arcuate nucleus is doing? See, from the puberty onwards, okay, from the time you attain the puberty, from then, this red color nucleus or the arcuate nucleus, it is releasing a hormone called as a GnRH. So, now tell me from where the GnRH is coming. The GnRH, the gonadotropin releasing hormone. GnRH stands for the gonadotropin releasing hormone. The gonadotropin releasing hormone is coming from arcuate nucleus. Why? Now, this GnRH through the hypothalamo hypophyseal portal blood vessels. Okay, hypothalamo hypophyseal portal blood vessels. Now, this GnRH, gonadotropin releasing hormone, is coming down to anterior pituitary. The structure which I am showing here, this is the anterior pituitary. Okay. Now, in the anterior pituitary, you can see the similar colors. Okay, same colors, color coding you can identify. So now this first cell which I am showing in the same red color, this is called as a gonadotrope. So gonadotropin releasing hormone, it is coming and stimulating which cell, guys? It is coming and stimulating the gonadotropes. So now these gonadotropes are going to produce gonadotropins. Gonadotropins called as FSH and LH. FSH, LH are the gonadotropins. Okay. So now it's the hypothalamus. It's the hypothalamus which releases the gonadotropin releasing hormone. The gonadotropin releasing hormone will come and act on the gonadotropes. So the gonadotropes are going to release the gonadotropins like FSH and LH. Now in the same way, this blue color nucleus which I am pointing here, okay, names are not that important. This blue color nucleus, it is going to produce a hormone called as a CRH, corticotropin releasing hormone. Okay, so now this corticotropin releasing hormone, look carefully, it is coming and acting on which cell? Same blue color cell called as a corticotrope. Now these corticotropes, whenever they are getting stimulated, now what do they release? Now they will release a hormone called as ACTH, adrenocorticotropic hormone. Now this adrenocorticotropic hormone, what it will do? Now the adrenocorticotropic hormone, it will go and act on your adrenal gland. Now when it is stimulating this adrenal gland is going to release mainly cortisol. Okay, now cortisol is going to come and cortisol is going to do its actions. The stress hormone is going to cause the glycogenolysis, proteolysis, lipolysis. That we'll discuss later. Okay, next step. Look at this green color nucleus, the third nucleus. Now this green color nucleus, it is releasing a hormone called as a TRH. What is the full form of TRH, guys? Thyrotropin releasing hormone. Now this thyrotropin releasing hormone, same through the hypothalamo hypophyseal portal blood vessels. This is going to come and act on the same green color cell here, same green. So this green color cell, now in this case is called as a thyrotrope. So here it is a gonadotrope, corticotrope, here it is thyrotrope. Now the thyrotropes are getting stimulated. Now when the thyrotropes are getting stimulated, now what do they release? They release as TSH. TSH stands for what? Thyroid stimulating hormone. Now where do you think this thyroid stimulating hormone is going to act? Now the thyroid stimulating hormone, it will go and act on your thyroid gland. Okay, it will go and stimulate your thyroid gland. So now your thyroid gland is going to release thyroid hormones like T3 and T4. T3 and T4 will be released. Done. Next step. So here the fourth nucleus which I am showing here, the orange color. Now what is this fourth nucleus doing? So it is releasing a hormone called as a GnRH. GnRH stands for what? Not GnRH, sorry, GHRH, growth hormone releasing hormone. So no wonder growth hormone releasing hormone. So it will come and stimulate cells called as a somatotropes. ST stands for somatotropes. Now these somatotropes, whenever they are getting stimulated, now they will release growth hormone. And you know what are the functions of the growth hormone? They help in the growth, epiphyseal growth. Okay, so growth hormone is released. Next step. Look at this, the fourth nucleus which I am showing in the pink color. Guys, now let me tell you, first let begins from the anterior pituitary. See the cell which I am highlighting here. Okay, this is called as a lactotrope. LT stands for what? Lactotropes. Now these lactotropes, they can automatically produce a hormone called as a prolactin. Okay, no need of any stimulus, they can produce prolactin. And what is the function of the prolactin, guys? The function of the prolactin is to produce the milk. It helps in milk production. Now my question to you is, imagine there is a 20-year-old female, okay, who is not yet married. Now imagine this 20-year-old female, is she having hypothalamus or not? Yes, she is having hypothalamus, anterior pituitary is there, breast tissue is also there. Then why she is not producing the milk? Without baby, there is no milk. That's normal, physiological, but question is why? She is having lactotropes, right? Now lactotropes can produce a prolactin. Prolactin can help in milk production. But why she is not producing the milk? The reason is this nucleus, last nucleus called as dopamine. See, this dopamine is also called as prolactin inhibitory factor, PIF, prolactin inhibiting factor. Now what this dopamine is doing? Dopamine or the prolactin inhibitory factor, see, it will always try to suppress. See, so far I am using the symbols here, positive means stimulation. But dopamine, here I am going to use the negative symbol. Negative means inhibition. So now the lactotropes are getting inhibited, guys. Lactotropes are getting inhibited. There is no concept of prolactin. There is no milk production. So what I am trying to say, sir, hypothalamus is showing inhibitory control. Hypothalamus wants to inhibit which hormone? Prolactin with the help of dopamine. So dopamine is also called as prolactin inhibitory factor. Okay. Now, not only this, here I want to add one more point. See, you know one brake. See, here there are 4 accelerators. These are all acting like an accelerator or stimulation. But there is one brake coming. What is that? Dopamine is trying to stop prolactin. Okay. That's the reason why after pregnancy, the dopamine levels will actually go down. When the dopamine levels goes down, Lactotropes will start to produce prolactin. Prolactin helps in milk production. Okay. Now I want to tell one more break here. There is a one more nucleus. Okay, which let me draw here in a small way. Yeah, there is one more nucleus. Now this nucleus, what it will release? Imagine it is releasing something called as a somatostatin or growth hormone inhibitory hormone. Somatostatin. Now what this somatostatin will do, also see in the name statin. Somato means growth, stasis means stop. So this somatostatin, also called as a growth hormone inhibitory hormone, GHIH, growth hormone inhibitory hormone. What do you think it will do? It will inhibit. It will try to inhibit the somatotropes. It will try to stop the growth hormone. So now tell me, hypothalamus can inhibit which hormones? Hypothalamus by producing the somatostatin can inhibit the growth hormone. Hypothalamus by producing the dopamine can inhibit the prolactin. So these are the two inhibitory controls which you should know for your exam. Okay. So look here, the inhibitory signal from the hypothalamus is shown on. Okay, what are the inhibitory signals? By releasing somatostatin, which is also called as a growth hormone inhibitory hormone, you can inhibit the growth hormone. By producing the dopamine, okay, by producing the dopamine, you can decrease prolactin. So this is the question which was asked. So I want you to know it. Next, what else you should know? Sir, out of all these cells, how many types of cells are there in the anterior pituitary? You know, there are gonadotropes, somatotropes, thyrotropes, corticotropes, lactotropes. These 5 different types of cells are there. Who is more in number and who is very least in number? See, the somatotropes are maximum in number. Somatotropes are maximum. And who is minimum, guys? Thyrotropes are minimum. So this also I want you to know. Who is more and who is less. Next, if you stain these cells, you know, in pathology, we used to stain the tissues. So if you stain a cell, either it will take a blue color or either it will take pink color based on its nature. Either it can be an acidophilic cell or a basophilic cell. Blue means basophilic, pink means acidophilic cell. So look here and tell me, sir, when you stain these cells, 2 cells are going to take pink color stain. The remaining cells are going to take blue color stain. Okay, blue color stain. So tell me, what are the acidophilic cells? The acidophilic or eosinophilic cells are somatotropes and lactotropes. So right here, what are the acidophilic cells, guys? The acidophilic cells are somatotropes and lactotropes. So these are acidophilic cells. And what are the examples of twin hormones? Twins means what? Same structure. Okay, same mother, same structure. So there are 2 hormones whose structures are almost same, whose mother is also same. Who are they? It's the same growth hormone and prolactin. Okay, so why I am saying this is because have I taught you growth hormone and prolactin, their mothers are same. Who is that? Acidophilic cell. Okay, both are having the same acidophilic cell as a mother. So growth hormone and prolactin, they are having a same mother cell, that's the acidophilic cell. Next, growth hormone, prolactin, they are having the same structure and their mechanism of action is also same. Have I taught you in the previous videos, the growth hormone, prolactin and leptin, they are all acting via the JAK-STAT pathway because they are all having the same structure. So these 2 hormones are called as the twin hormones. So just remember, whenever the growth hormone level increases, prolactin levels also increases. Usually they go up and go down at the same time. Next, okay. Next, see, all hypothalamic hormones are released in pulses, means they are not releasing continuously, they are releasing little by little in regular intervals. Okay, but there is one exception, that is a TRH. Okay, TRH. So this thyrotropin releasing hormone is the one exception, while all other hormones are released in pulses. Pulses means little by little, something like that. Okay. Next, after this, now let's see. Okay, let's begin our topic with this gonadotropes. First, let's see this FSH, LH function in our body. In the later videos, we'll discuss about functions of the cortisol, we'll discuss about the functions of the growth hormone, thyroid hormone, prolactin. We'll go one by one. So in this video itself, let's start talking about the functions of FSH and LH in our body. Now you tell me, see, FSH का full form क्या है, sir? What is the full form of FSH? Follicle stimulating hormone, and LH stands for luteinizing hormone. FSH, where do you think it's going to act? Follicle stimulating hormone. So definitely it should go and stimulate the ovarian follicles. So in females, the FSH, it is coming and acting on their ovary. In the ovary, what do we have? Follicles are there. See, here is a follicle. Now you will start to have a doubt. Sir, what exactly is a follicle? Follicle means a oocyte. See, in the center there is a oocyte. Okay, you can see a oocyte. surrounded by these granulosa cells. A oocyte surrounded by granulosa cell is called as a follicle. So this entire structure is called as a follicle, and follicle is made up of a oocyte and surrounding granulosa cells. So now what happens? In a female menstrual cycle, female menstrual cycle is of 28 days. Okay, in a normal female, it's 28 days. So what happens in the first 14 days of our menstrual cycle? First 14 days are called as a proliferatory phase, okay, or follicular phase. So in the first 14 days of the female menstrual cycle, what happens is the FSH, it is coming, see, first 1 to 14 days, it is coming and it is stimulating the follicle. It is stimulating the follicle, especially the granulosa cells. Okay, so the granulosa cells of the follicles are getting stimulated. So now tell me, when the follicles are getting stimulated, now the follicles will start to undergo maturation. Okay, now they are in dormant stage. Now these follicles, because of the FSH, now they will start to mature. Okay, a group of follicles, not only one follicle, a group of follicles, 10 to 15 follicles, let's say. Now they are starting to mature. Now see, under the influence of FSH, the follicles are maturing, the granulosa cells, now do you know what they will do? They are going to release two important hormones called as estrogen and inhibin B. So who is getting produced, guys? Estrogens and inhibin B. So in the first 14 days of the female menstrual cycle, it's the estrogens and inhibin B is getting released from the granulosa cells because of the FSH. Now, what is the function of this estrogen? Okay, what is the function of this estrogen? Tell me, in females, what estrogen will do? Estrogen, yes, number one function, helps in breast development and maintenance, breast development. If you take out estrogen from the female body, the breast will undergo atrophy. So breast development. Next, the same estrogen, it will go and act on the uterus. It will go and stimulate the uterus. So there is growth of endometrium. Okay, there is endometrial proliferation. So that's the second function. And females are little short. When compared to males, females are short. Do you know the reason why? It's the same estrogens which will help in the closure of epiphyseal plates, early closure of epiphyseal plates. See, why I'm talking this here? Because this is an MCQ. So what is the hormone responsible for the early closure of epiphyseal plates? Okay, going to stop the growth. It's the estrogens. So remember, estrogens, what they are doing in the first 14 days of the menstrual cycle, it's going to stimulate the breast, helps in the breast development and stimulating the endometrium to grow, causing the endometrial proliferation. Done? Now I'm asking, once you are having sufficient amount of estrogens, do you require further FSH? I'm asking you, you require physiological quantities of estrogen or pathological quantities of estrogen? It should be normal. Always the estrogen level should be regulated normal. So once you are having enough amount of estrogens, do you know what happens? This estrogen along with this inhibin B, what they are doing? They are giving the negative feedback to FSH, saying that FSH, enough amount of estrogens are there, no need of further stimulation. Okay, don't produce excessive estrogen, because whenever there is too much FSH, there can be too much estrogens, too much stimulation and too much estrogens. So which is not good, because it can lead to too much amount of estrogens, or hyperestrogen states can lead to the breast cancer, uterine cancer. So what I'm trying to say, once you are having sufficient amount of estrogens, this estrogen along with the inhibin B, what they will do? They will give the negative feedback. They will down regulate the FSH. Okay, done. Now, how many days completed? First 14 days completed. Now tell me, in the first 14 days, these granulosa cells or these ovarian follicles, what they are doing? Releasing estrogen. So tell me, on 14th day, you will be having lot of estrogens or less estrogens? You will be having lot of estrogens, because from the day 1, gradually the estrogen levels are increasing, because the ovarian follicles are getting developed, they are getting matured, so they are releasing more and more estrogens. So on the day 14th, you are having lot of estrogens. Now, do you know the same estrogen, what it will do? It is this high levels of estrogens. When you are having a high levels of estrogen for certain period of time, so these estrogens are giving the positive feedback, which I am not showing here, but try to understand. On the 14th day, it is the same estrogen which will give the positive feedback. It will stimulate the gonadotropin to release LH. So now who is coming, sir? LH is going to be released. So on the day 14th, see, on the day 14th, suddenly there is LH, sir. Suddenly the LH levels booms up. Okay. So now tell me, the positive feedback for the LH is given by what? Estrogens. But the estrogen, see, estrogens are having two phases. What estrogen is doing? It's the same estrogen giving the negative feedback to FSH, but it's the same estrogen which is giving the positive feedback for the LH surge. Understand? So on the day 14th, there's lots and lots of LH in the blood. Now, tell me, how many days completed? 14 days completed. Now, in the first 14 days, what happened to the size of the follicle? The follicles are getting developed. No, because of the FSH, the follicle is growing. So now I am showing on day 14. Look at this follicle. The follicle becomes matured. Now this is the follicle on the day 14. So this matured follicle is called as what? Graafian follicle. So on the day 14, there is one follicle which is going to be matured. This is called as what? Graafian follicle. Okay. Now what happens? On the day 14th, this LH will come and act on this Graafian follicle. LH is going to act on this Graafian follicle. Now, whenever the LH is acting on this Graafian follicle, the Graafian follicle, it will undergo rupture, sir. Okay, the follicle is going to undergo rupture and releases this central oocyte. See, the central oocyte, whatever is there, it is released, and this process is called as what? Ovulation. So now tell me, this ovulation, the ovulation, is it because of estrogen or LH? Yes, definitely it is because of LH. It is the LH surge, it's the LH which is going to cause the rupture of the Graafian follicle, leading to ovulation. Done. Now, what happened to this ruptured Graafian follicle? Now this ruptured Graafian follicle, this is the same Graafian follicle which is ruptured. Now it becomes a structure called as corpus luteum. So the ruptured Graafian follicle is nothing but the corpus luteum, guys. Okay. Now see, here is the ovum. Now ovum is waiting for what? This ovum or the oocyte is waiting for the sperm. If sperm comes, fertilization will happen. There will be pregnancy. Without sperm, automatically there won't be any pregnancy and menses will come. But question is, what this corpus luteum is going to do? On 14th day ovulation happened and there is corpus luteum. This is all happening on the day 14th. Now what this corpus luteum is going to do? The corpus luteum also produces certain hormones which can favor the pregnancy. See, corpus luteum, what it will do? It is going to produce a hormone called as progesterone and inhibin A. Inhibin B is produced from the granulosa cells. Now it is a corpus luteum which is going to produce the progesterone and inhibin A. Now can I say something like this? It's the FSH helps in the production of what? It is the same FSH helps in the production of estrogens, and the LH, what it is doing, helps in the production of progesterone. So FSH for estrogen production, LH for progesterone production. Once you have sufficient amount of estrogens, what estrogens did? Estrogens are trying to give the negative feedback to FSH, and see, the same progesterone also doing the same thing. Progesterone is trying to give the negative feedback to LH. So let me write the same thing here. Guys, always remember, this will help you in your gynae also. FSH helps in the production of estrogens, LH helps in the production of progesterone. But once you have sufficient amount of estrogens and progesterone, estrogens give negative feedback to FSH and progesterone gives the negative feedback to LH. Negative feedback. Done. Then, if they ask about the inhibins, what inhibins do? I have taught you inhibin B is coming in the first 14 days, inhibin A is coming in the next 14 days. Inhibin B from granulosa cells, inhibin A from the corpus luteum. So, inhibin A and B always, see, name itself is there, inhibin inhibits, gives the negative feedback to FSH only. FSH. Now you might be having a doubt, sir, why inhibin A is coming in the next 14 days? I am asking, do you require FSH in the next 14 days of the menstrual cycle? Is there any need of FSH? No, we don't want FSH. We want the FSH to be present in the first 14 days because FSH helps in the follicle maturation. We don't want the FSH, right? In the second half of the menstrual cycle, we don't want FSH. What is the point of having FSH in the second half of the menstrual cycle? So we don't want FSH. So who will inhibit FSH? It is the inhibin A, inhibits the release of FSH. Okay, we don't want the FSH in the first 14 days. Okay, so both inhibin A as well as inhibin B will try to give the negative feedback to FSH. Next, inhibin A is produced from, you already know, inhibin A I have taught you, coming from the corpus luteum. But inhibin A is also produced from where? Placenta. It is also produced from placenta. Placenta also produces the inhibin A. Have I already taught you this? The positive feedback for the LH surge on the 14th day is given by estrogens. It's given by the estrogens. It's the estrogens which gives the positive feedback. Okay, done. So with this successfully, what we have completed? We have completed the functions of the gonadotropins like FSH and LH. Now here I want to add one more point. Can I say something like this? Whenever you are having dopamine levels, high levels of dopamine, dopamine always tries to decrease what? Prolactin. So if you are having high dopamine, your prolactin levels decreases. So these two hormones, they are antagonistic hormones. Okay, they are antagonists, which means one hormone is trying to decrease the other hormone. Antagonists. Okay, done. Next, so far what and all we have discussed here, this is all happening in a female, what FSH is doing in a female and what LH is doing in a female. Now let's talk about the males also. Okay, now look at what is happening in a male. Now males do have hypothalamus, guys. Okay, males also are having hypothalamus, and here this is the pituitary gland. Now what exactly is happening? See, this arcuate nucleus, it is also going to produce what? GnRH. Arcuate nucleus is producing the GnRH. Now this GnRH, see, in pulsatile doses, it is coming and stimulating what? It is coming and stimulating the gonadotropes. So in males also gonadotropes are there and they are getting stimulated. Now these gonadotropes produces FSH, LH. You already know it. Now, where do you think this FSH and LH are going to act. In males, where do you think this FSH and LH are acting? Do you think they are coming and acting on the ovaries? Males do have ovaries? No, definitely not. So in males, the gonads are testes. So here what you can see is a testis. Okay. Now FSH is coming and acting on which cell? FSH is acting on a cell called as a Sertoli cell. The LH is acting on a cell called as a Leydig cell. So remember, L for L, S for Sertoli. So Sertoli cells are stimulated by FSH. Leydig cells are stimulated by LH, L for L. Okay, L for L. Okay. Now let's see. Whenever the FSH is acting on the Sertoli cells, you know what the Sertoli cells will do? So Sertoli cells, they will release certain hormones. What Sertoli cells are releasing? Sertoli cells releases inhibin B. In boys it is B. So inhibin B is coming from Sertoli cells. Not only that, the Sertoli cells also produce something called as a hormone called as anti-Mullerian hormone. Do you want the development of the Mullerian duct in males? Mullerian duct forms the fallopian tubes, uterus, okay, cervix, upper one third of the vagina. Do you want a Mullerian duct to develop in the males? No, definitely not. A male's testis is going to produce, especially the Sertoli cells, are going to produce something called as the anti-Mullerian hormone, which will cause the involution of the Mullerian duct. So, inhibin B is coming and anti-Mullerian hormone is coming. Not only that, these Sertoli cells, they are considered as a nursing cells. Nursing means what? They are going to take care about cells. Which cells? They are going to give the nutrition for the sperms. They will take care about the process of spermatogenesis. Okay, so they are nursing cells. They will help in spermatogenesis process, sperm production. And not only that, these Sertoli cells, they are also forming a protective barrier for the testis. So around the central nervous system, we are having something called as a blood-brain barrier, which is formed mainly by the astrocytes. In the same way, your testis is also having a barrier which doesn't allow any toxic substances to enter into the testis. So that is called as a blood testicular barrier. So that blood testicular barrier is formed by which cells? Sertoli cells. Tell me, FSH stimulates Sertoli cells. Sertoli cells produces anti-Mullerian hormone. Sertoli cells produces inhibin B. Helps in spermatogenesis. Sertoli cells are nursing cells. They forms blood testicular barrier. Now, let's look at the LH. LH is acting on which cells? Leydig cells. Now, when the Leydig cells are getting stimulated, now it is the Leydig cell which produces testosterone. Okay. Now, look carefully. Have I already taught you wherever you see the word inhibins? Inhibins, what they will do? Inhibin will give the negative feedback to FSH. And what this testosterone will do? Testosterone will give the negative feedback to LH. Just simple, like a feedback mechanism. Now you tell me that testosterone, okay, whatever is getting produced, it should be converted into a more powerful androgen. Testosterone is an androgen, sir, okay. But with the help of an enzyme called as a 5-alpha reductase, okay, with the help of an enzyme called as a 5-alpha reductase, the testosterone will be converted into a more powerful testosterone called as a dihydrotestosterone. So, right, dihydrotestosterone is the most potent androgen. It's the most potent androgen, guys. And this dihydrotestosterone is responsible for the development of male external genitalia. Okay, development of male external genitalia like penis and scrotum. Okay, so the development of the external genitalia is not because of the testosterone but because of the dihydrotestosterone, which is most potent androgen. Now, because of this dihydrotestosterone, some problems are also there. Okay, it will also cause some problems. The high levels of dihydrotestosterone can lead to androgenic alopecia. So it's a DHT which is going to be responsible for androgenic alopecia. Androgenic means what? In males, alopecia means baldness. So the baldness which is happening in a male, that is because of the dihydrotestosterone. Next, the dihydrotestosterone also stimulates the prostate gland to overgrow. So which is leading to a condition called as benign prostatic hyperplasia, BPH. Recently it is also called as a nodular hyperplasia of prostate. So benign prostatic hyperplasia. Okay, imagine here is the urethra. The urethra is surrounded by a gland called as prostate gland. So because of the dihydrotestosterone, the prostate gland size will increase, especially in elderly people. The prostate gland size will increase. While the prostate gland size is increasing, it will compress the urethra. So the person is going to have problem with micturition. Okay, there is problem with the urination. He will have a urge for urination. He will feels like he's having the urination, but once he goes to the toilet, no, it's difficulty. There is a difficulty in urination. The urine is not coming easily. Okay, because the urethra is getting compressed because of the prostatic overgrowth. So again, the benign prostatic hyperplasia or the androgenic alopecia, they are because of what? They are because of the dihydrotestosterone. So now tell me, imagine I am the one who is having androgenic alopecia. So tell me which hormone you have to decrease in me? You have to decrease this dihydrotestosterone. If you want to decrease this dihydrotestosterone, which enzyme you have to inhibit? You have to inhibit this enzyme called as 5-alpha reductase. So there is a drug called as finasteride. So what this finasteride will do? Finasteride inhibits 5-alpha reductase. 5-alpha reductase. So it can be used in the treatment of androgenic alopecia, and to a certain degree it can be used in the treatment of BPH also. Done. Next, see, in females also testosterone is produced. Okay, in females follicles, there is something called as theca cells, the theca cells. In females, yes, testosterone is produced. Okay, the testosterone can be produced. Now this testosterone in female can be converted into estrogens. In females, the testosterone whatever is getting produced from the female ovaries produces a testosterone. True, the theca cells, especially the theca interna cells. Now the testosterone whatever is getting produced with the help of an enzyme called as aromatase, it can be converted into estrogens. Okay. Now aromatase helps in the conversion of the testosterone into estrogen. 5-alpha reductase helps in the conversion of the testosterone into dihydrotestosterone. Next, apart from this, what else you should know? Guys, here is the histological image. You can very clearly see these are the seminiferous tubules. These are all the seminiferous tubules where the spermatogenesis is happening, and which cells will be there inside. The serotonin cells will be there, which are helping in the process of spermatogenesis. All these cells are the sperms. Okay, from the spermatogonia, the sperms are getting developed. But in between them, the cells whatever are present over here, the cells which I am highlighting here. See, for example, these cells which I am highlighting, they are interstitial cells of Leydig. It is the interstitial cells of Leydig. It is the interstitial cell of Leydig which is going to produce a testosterone. So you might get a question something like this. They will round up the cell and they will ask you, what is the cell? It is the interstitial cell of Leydig helping in the production of testosterone. Okay. So with this, we have completed the basics of the anterior hypothalamic hormones and anterior pituitary hormones. In the next video, we'll be discussing about the clinical cases. Okay. What happens if the pituitary stalk is damaged? What is Sheehan syndrome? How to treat the precocious puberty and how to treat the delayed puberty. Okay, that and all we will discuss in the subsequent video. Hope the video is helpful. Thank you.